Good evening, class. My name is Fernando, and this evening I'll be doing a dual presentation with Sarah. Say hi, Sarah.
Hi, guys.
Hi, and now we're going to take this moment to introduce ourselves.
I'm Naomi Smith. I am one of the group members.
I'm Lisa Coronado. I'm one of the group members.
I'm Danny Pena. I am one of the group members.
All right, thanks, guys. And today we're going to be looking at vitamin D and postpartum depression. Can we move on to the next slide, please? Thank you. And this is just a brief summary of the study, which includes also the title, which is vitamin D status during pregnancy and the risk of subsequent postpartum depression, and it's a case control study. The study looked at 607 women who were part of the women who had postpartum depression, and 875 who did not have postpartum depression, and that was made up of the control group. The women had blood drawn at different stages during the pregnancy, and they found no association between the levels of vitamin D and postpartum depression. Can we move on to the next one?
Sure.
Thanks. One more back. There we go. Rationale, according to the authors, postpartum depression is a public health problem which affects 10 to 15% of women worldwide. Postpartum depression may affect the quality of mother-infant interaction and affect the cognitive and emotional development of the infant. Their hypothesis was that women with low vitamin D are prone to depression, and events behind childbirth provide a push to send already at-risk women into clinical apparent depression. At this moment, I was wondering if anybody has any questions or comments.
Hi, this is Lisa. Not a question, but I noticed in this, because we've been doing previous articles all about postpartum depression, this is the first time that I noticed in this article they actually explained what symptoms were of postpartum depression. So
right.
I like the fact that they did that.
Yeah, it was, and it was pretty extensive. Right, they even had like the symptoms of what they were expecting, such as loss of appetite, sleep disturbance, poor concentration, memory problems, fatigue, irritability, sense of guilt, and it just kept going and going and going. And it seems like they made it to seem more of a complex issue that affected many aspects of life.
Yeah, I have a comment. This is Sarah speaking.
Sarah.
Hey. So I did think that was actually really great that they mentioned those things, because a lot of people might not consider postpartum depression to be, like irritability or not being able to sleep well or eat well or just different things. They might think of it as something like, I have to consciously be depressed about something, instead of more of like a symptomology behind, everything that's going on with them. So I thought that was really cool that they did go through and mention some of the symptoms.
Right. Yeah, I was going to try to fit it in the slide, but it was just impossible. So it was like 2 paragraphs worth.
Oh, sorry about that, guys.
All right, so are we done with this slide?
Ready for the next one?
All right, ready.
Yep.
All right, so population sample and data collection methods. They went through the Danish National Birth Cohort and recruited approximately upwards of 91,000 women between the years of 1996 and 2002. Eligibility was behind, they had to be born in Denmark, had a singleton pregnancy, delivered a living child, and had blood collected late pregnancy. Estimated, the weeks they needed were weeks 10 to 12 and 25. So as mentioned earlier, case women were 605 who had to have failed antidepressant medications within 1 year after childbirth, but not been hospitalized for the postpartum depression. The control group was 875 women who did not fill a prescription and thus were not hospitalized either for postpartum depression. So the samples the blood samples were shipped by mail, which took between 28 and 48 hours. They were stored for 9 to 15 years before being tested. And they were looking for 25 OHD3 and D2, but D2 turned out they didn't consider it in the analysis. Any remarks on this slide?
Just one quick question here. This is Sarah, by the way.
Hi.
I was trying to understand, so they did check the D3, D2 levels, but they didn't actually count the D2 towards the final analysis?
No, they did not. They said it was negligible. So there wasn't either enough, or the data they were getting wasn't enough to say anything about the study. So they stuck to D3.
Okay. Are you ready for the next slide?
Hey, this is Danny. Just real quick. So I know it said something that they gathered, like it was like 91,000 women that they had initially, I guess, interviewed or talked to. And then they went down to 875 controls and 605 actual people.
Right.
Do you want to discuss, or I can, it doesn't matter, why they excluded and got rid of like a lot of those people?
Sure. What do you think happened?
So the only thing that I wanted to bring up is that it said that if people were previously treated with antidepressants or had any kind of psychiatric problems, like previously before they were pregnant, they were automatically taken out of the study as well.
Yeah, true.
Yeah.
Which, I mean, if you look at it, I mean, if that was, they started out with that big, huge number, and they ended up with, what is that? That's not even...
Pretty much a fraction of it, man.
So it's like all those people in Denmark are a little loopy.
I noticed that, and I thought that it was really interesting that they brought it down to such a small number after taking so many blood samples. And I think it was even, if I remember correctly, I believe it was like over a year before they even got, it had to be like a couple years that they hadn't experienced any sort of depression or mental illness or treatment for that within, I think, a year or a couple of years prior to to be counted towards this.
Yeah.
Yeah.
There was definitely a lot of incidences of people that had been previous, or women that had been previously treated for depression or other mental illnesses.
This is Naomi. I just had a question about that. So that's a really large amount of women that reported some kind of symptoms of mental illness or depression. Did they differentiate for these women the difference between postpartum depression and like the baby blues? That it's normal to feel kind of down. For roughly 6 weeks after delivering a baby. Did they kind of help to differentiate that for these women, or?
No, I didn't see anything like that. It just, I don't know if Sarah saw anything. Did you see anything like that, Sarah?
I was trying to read through it a couple times. Some of the parts were a little confusing to me, but I didn't notice any type of differentiation at all, just what they had specifically named at first for the symptomology, or the few symptoms that they had mentioned as being, components of postpartum depression.
This is just such an interesting study because they are so, there's a lot of psychiatrists and mental health professionals that are such big proponents of giving people vitamin D3. I mean, I can think, just at the jail alone, I can think of at least 20 or 30 inmates that they have on vitamin D3 because they're not getting really any exposure to sunlight, and they're concerned about their mental health. And I can think of a ton of inmates they have on D3, and I wonder. I'd be curious to see if this is just specific to postpartum depression, or if this is all people with depression that vitamin.
It might be correlated to the hormones during pregnancy, and
yeah.
Because I didn't expect the outcome of the study. You know what I mean?
Well, also I think I haven't recently read any, this is Sarah, by the way, I haven't recently read any studies about the correlation between vitamin D and depression. I know it exists, but I wonder, if it's different, if it's like serum, like if it's in your blood, the vitamin D in your blood, or if it's like, if it matters, like if you're outside and you're making it from the sunlight. I'm just wondering, like, if it matters kind of if you're taking it in a pill form, or if you're like kind of receiving it naturally, or like, I don't know. Anyways, I just wonder if it makes a difference how it's absorbed or something like that.
Yeah, I think from what I remember from nutrition class last 2 semesters ago, I think it does matter. I think the better way you want to get it is from the sun. And in retrospect, you also need to have good calcium intake so you can actually absorb the vitamin D. So, and I know with like women, I think they're going to be depleted in calcium because of the hormones going on. Absolutely. And so, I mean, it's just tough.
Yeah, that was a really good point about the calcium intake as well. I kind of forgot about some of those things.
Yeah, it seemed like so long ago, doesn't it?
Oh, yeah. Okay, so do you have any more comments for the population sample and data collection methods?
No, I think the other comment I was going to say, it did seem like a big drop off between 91,000 and get into, it looks like 1,400 they actually accepted. Mm-hmm. But they did have a lot of exclusions, and also we don't see any participants that really dropped off of the study. So I don't know if like maybe they just didn't report on the people that dropped off as well, as we had on the other cases when we were able to bring up issues about incentives and anything like that.
Well, I think, this is Sarah, I think for this particular study, I think they just left it at, you got your blood drawn and we kept that for testing and that's it. I don't think there was further questioning or anything. I don't think they were like...
So they were going through maybe the database probably, to try to figure out if they were on antidepressants after, like within a year after delivery?
Yeah, because
okay.
I don't know how they ultimately did it, but I don't remember reading anything about them meeting with these women or anything like that.
Right. No, yeah, that's a good point.
Does anyone know?
This is Danny. They didn't, I think you guys are right. They didn't say they met with anybody. Primarily, a lot of it was just them getting blood samples when they came in for their routine exams, which kind of was what we were always saying, like with all the other past surveys and reviews or whatever, was that they relied on them to submit all the samples, whereas in this study, they actually did it while they came in for their routine exams. And then the other thing that it did mention was, briefly, is that most of the samples they froze and kept frozen for like a long period of time. And it was so that they can keep track of these women, and if they did get a prescription and or go on the psychiatric list that they had, then those blood samples would be automatically taken out of the study as well. So I thought that was kind of interesting that they froze all these samples. So
for a long time too.
Yeah.
Estimated 9 to 15 years before being tested.
Yeah, that was going to be my question about why they would have stored it for that long. So it sounds like they stored it for the purposes of, in case women got onto an antidepressant, they would get rid of it. Is that
probably
okay?
Or be able to test it.
It just seems, Sarah here, it just seems like a really long period of time to hold on to it.
Mm-hmm.
When I think they were only testing until if the woman who had given birth had maybe accessed some sort of medication or antidepressants within a year postnatal.
Yeah, that's why I was wondering, like, why 9 to 15? Like, was there a budget issue in testing them? Or
it seemed like a really long time.
Mm-hmm.
And it made me kind of question, the material, the blood that they tested.
Mm-hmm.
I mean, I'm not very knowledgeable about that, but it just seemed like thawing it out and like keeping it for that long, and then like it just seems like the blood went through so many different temperature changes, and
Yeah.
for years.
Yeah, and in addition to that, like the mailing process of it.
Yeah.
Like I know I'm not a researcher or anything, but I watch a lot of like detective shows, like you know what I mean. So like what part of this would have the blood become not viable for like what they need it for? Like what was it? D2 became not to be considered anymore. You know what I mean? Was it maybe due to the process of the blood handling, or sorry about the baby crying in the background. So yeah, Sarah, you want to take it from here? I think your next slide.
Oh yeah. Okay. So let me get on here. So Fernando and I were looking at the strengths and limitations. And so some of the strengths that we saw was there was a huge sample of women that gave blood. Unfortunately, the study didn't use very many of them, but I thought it seemed like a really strong sample at first, and it allowed to draw from a lot of different women. From our reading, I saw that it was a diverse sample of women, educationally and socioeconomically. I thought it was great that they were ethical and they got proper consent before using any of the blood samples for study. And their statistical methods seemed sound. It seemed like they tried out, they like studied a bunch of different types of vitamin D. They studied the proper levels of what it should be like in the blood or in the body. And so it seemed like they did a lot of research into that. Some of the limitations we noticed were that it was a culturally homogeneous sample, as it was from Denmark. And it seemed like a lot of the women who had symptoms of postpartum depression, like some of them could have had symptoms, but they didn't fill prescriptions. So those women weren't included in the case group, and they could have been put into a control group, which may not have been the proper group for them. Since they just solely based that upon getting a prescription, as opposed to maybe therapy or some other kind of treatment modality for depression. Like we had mentioned just on the last slide, the blood samples seemed a little bit old and they underwent thawing and room temperature changes. I don't know if that's actually like a problem in terms of handling and testing, but it did seem like they held on to that for kind of an absurdly long period of time. And there were a lot of potential co-founders that existed that could alter the vitamin D levels of these women, like smoking or multivitamin use. Well, I also thought it was kind of strange that the study didn't look at the postnatal vitamin D levels in these women. They only looked at the prenatal levels. So I was just going to open this up for any comments or questions.
This is Naomi. I'm really glad that you brought up the potential confounders as far as smoking and multivitamin use. I mean, I think here for sure in the US, and I would think probably in Denmark too, it's most pregnant women take a prenatal vitamin. I mean, every OB that you go to will tell you take your prenatal vitamins. Are you taking your prenatal vitamins? And I'm sure there's different kinds of prenatal vitamins that women take. I don't know if D3 is one of the prenatal vitamins. Did they account for how much time these women like spent outside or in the sun? Did they, there's a lot of variables, I think, that would go into what someone's vitamin D levels are. And it may not be like natural vitamin D. It could be, like you said, from, multivitamin use or supplement use. And also, I thought your limitations were really good. I think you really hit on, a lot of the limitations of the study really well.
Any other comments or questions?
Yeah, I just have a quick comment. The thing that they had talked about was the 605 people as compared to the controls. they had said that the 605 people were low socioeconomic status, and a lot of them were indeed smokers. And then majority of them also had prior childbirths and poor social support in general in the beginning, as far as like with family support and stuff of that nature. So just interesting as far as it being in relation to their controls. That was it.
That was a good comment.
But that was Danny, by the way.
Yeah. I had a comment. It was at the tip of my tongue, and now I've lost it. See if I can remember it. I can't. Maybe it'll come up in the next slide. So we have some follow-up questions. Some of the questions were, what can we take from the study for future care of postpartum depression patients? Do you think that postnatal vitamin D testing would have been beneficial to the study? What were some key elements that you felt strengthened the study or weakened it? And do you believe that the potential confounders disputed the integrity and results of the study? As well as how would you improve the study? So those are just a few questions. We'll start with the first one. What can we take from the study for the future care of patients experiencing postpartum depression? Anyone want to comment?
Hi, Lisa here. Well, given their results, I don't know how much of an indicator that we have for vitamin D and postpartum depression. I mean, there seems to be a correlation with depression in general with vitamin D, as the study pointed out. But the fact that their results were kind of inconclusive, I'm not really sure how much of an indicator this study would be for actually giving care for patients of postpartum depression. I think in your last slide with the weaknesses that you pointed out, the fact that they didn't monitor the vitamin D after pregnancy, I think that would have been helpful in maybe seeing that variance or that difference between being pregnant and not being pregnant.
I agree. I think another important thing is, since actually the opposite occurred for women with higher vitamin D levels, it might be important to check out, maybe some women are trying to be super healthy and like on it with their pregnancy and taking supplements and whatnot. And we might want to warn women maybe not to take too much, or maybe test their levels prenatally just to make sure that they're not taking too much vitamin D or getting too much vitamin D, because maybe that would lead to postpartum depression. We probably want to keep them in that appropriate level. Mm-hmm. Anybody else for that question? Okay, next question. Do you think that postnatal vitamin D testing would have been beneficial to the study?
This is Naomi. I think that postnatal vitamin D testing would have actually been more beneficial to the study, because you're going to see these are the people's vitamin D levels post-delivery, and now it's correlating with these symptoms. We have no idea. What if after they delivered, they had this major drop in their vitamin D levels, and it's this drop in the vitamin D levels that's causing the postpartum depression? Maybe they're used to this high like blood level of vitamin D, and then whatever happened during delivery like caused it to drop, and it's that drop that they're feeling. We have no idea, because we don't have there's so many things that could have happened to that vitamin D level post-delivery.
I agree.
And it would have been really, I think, beneficial, useful, almost more useful to have the postnatal vitamin D levels. Frankly,
we used to check prenatal and postnatal, and then maybe 2 to 3 months after that, or like check at 3 weeks, 3 months, something like that.
Well, they had enough resources to take the blood of 91,000 people. How about take the blood of 45,000 people twice? That would have been more beneficial, I feel like. You know what I mean?
Mm-hmm. Good point. Anybody else?
Lisa here. I do have, actually, just kind of going into that what you guys were just saying. Do you guys know, because I have a friend that, like, she was pregnant and then she gave birth, and after she gave birth, like, her teeth were, like, really bad, her hair started falling out, like, all of these changes happened after giving birth. She was kind of freaking out, like, what happened to her body. So I don't know if you guys know, like, there must be lots of hormonal drops after pregnancy, right?
Yeah, or like maybe absorption issues or coming back to homeostasis issues. I don't know particularly, but it would be really interesting to kind of look into that and check out some research associated with that, because that could have a lot to do with the development of postpartum depression. It could be like Naomi said, that maybe levels just dropped, maybe not just vitamin D, maybe a lot of levels dropped, and that affects women hormonally and emotionally. And
Hey, Fernando right here. I think the same, I remember from nutrition, I think during that, during the pregnancy period, we have minerals, nutrients, vitamins are being depleted because they're pregnant. And then in addition, they're being depleted during the nursing period. So that's why they recommend space out your pregnancies, like 2 to 3 years, I think, so you can get all the nutrients that you've lost to that process.
That's a really good point. Also with colostrum and stuff like that, I'm sure a lot of nutrients are shunted off to breast milk. So that could be part of it. Any other comments on that question, guys? Okay, we'll be, anyone else? We'll move on to the next one. What were some key elements that you felt strengthened the study or weakened it? Anyone want to comment on that? We've kind of discussed a little bit of it.
This is Naomi. You know, like you said, we already discussed it. I felt like the key elements that strengthened the study were the sample size. That was, I mean, it was a huge sample size initially anyway. I don't know what happened towards the end there, but 91,000 people sounds really good. And then as far as like things that weakened it, I think you did a really good job of hitting on all of those things, you know, not getting postnatal vitamin D testing, only limiting that sample size after the initial one, didn't take into consideration things like smoking, multivitamin use. I think you did a really good job of hitting on all of those things already.
Okay, great. That kind of goes with this follow-up question. Do you guys believe that potential confounders disrupted the integrity and the results of the study? I think it's safe to say yes, but anyone want to make any further comments about that?
Yeah. Hi, Danny. Yeah, no, definitely, especially because of the nutritional factor that comes into play. I mean, it didn't say anything about them actually supplementing them or giving them any supplements of vitamin D. And especially since a lot of these people had low socioeconomic status, how can they have afforded anything that would help increase the vitamin D that they either were taking, not taking, or whatever the case may be? Because it sounds like all they were doing was just testing their blood levels in general and not supplementing them or giving them any options to get vitamin D in any way either. So I definitely think it disrupted the integrity of the study and could have played a major factor in it, especially since their control group possibly had more financial attributes and was able to actually contribute and buy, these said supplements as well. So just kind of goes back to all the other studies that we've been reviewing about socioeconomic status having a lot of involvement with a lot of the results.
Anybody else?
I think we're coming up on time.
All right. Anyone want to mention anything on how they would improve the study? I think we already talked about a lot of that stuff. So I think the main ones were maybe having a smaller study sample and checking in with them and doing more frequent blood tests prenatally and postnatally. And then, yeah.
Yeah, I agree. This is Danny again. Hi. Yes, I agree with what you said, Sarah.
Okay, great. Anyone else want to mention anything before we close out our journal session?
This is Lisa. I just wanted to say that maybe, because this is the same type of correlation that they find between like people that live in places like Seattle, right? Like the depression kind of syndromes.
Mm-hmm.
So maybe taking some of the studies, kind of the way that they study the people in those kinds of studies, and trying to put that with low pregnant women to try to test them that way.
Yeah, I think it's important to note that I'm not familiar with the weather over there, but maybe that would have something to do with it as well. I think that could be a good point. Okay, guys, I'm going to stop recording here. Thanks for participating in our journal.
Mm-hmm.